It's Saturday night, almost Sunday morning, right around midnight. I just got off of a 8-hour shift in the ED. All things considered, I'm doing great. Physically, I feel great. Mentally, doing very well. I'm a little tired. Working 8 hours in PPE is not easy. Breathing through that mask for 8 hours gets pretty old. Wearing all that gear gets pretty hot. But besides that, I really have no complaints. I feel pretty well. Like any point, when things start going bad, whether it's the economy, a medical issue like this current outbreak, whatever it might be, it's really the marginalized people in the population who take the brunt of it, and that's our patient population. So the reason I'm here is to take care of people who really have nowhere else to turn. That means a lot to me, and I think it means a lot to everybody who works here. We all take a lot of pride in knowing the patient population that we care for. The sheer number of patients that you see is overwhelming at times. Without going into the numbers, just the volume of patients and how sick they are is surprising. And these are not just older patients that are coming in and sick. This is young people younger than me, who are critically ill. It's pretty tough to see. And although compared to 2 weeks ago, the numbers haven't really gotten worse, they're not really obviously getting better at this point either. And part of the problem is you're looking at things kind of with a 2-week lag. So I do believe that all the shelter-in-place efforts are making a huge difference. And I think we're kind of on that flat part of the curve now, but the patients are still coming in, and lots of them every day. So it's important to stay home. I think what myself and my colleagues are going to struggle with over the next few weeks, and really all of society as a whole, is realizing that this whole pandemic at this point is a marathon and not a sprint. The fact that patients are going to keep coming in and that we don't know what the new normal is, I think that's the hardest thing to deal with, both for myself in the healthcare field, but also for my patients. It's hard enough trying to battle COVID, but on top of that, not knowing if you're going to have a job to go back to or where your next meal is coming from or how you're going to afford rent is horrible. I've been fortunately blessed to not have to worry about those latter ones, but lots of people do right now. And I think that's the hardest part, is it's really setting in how long of a road this is going to be before we really can start to get a handle on it and move past it. And I think everybody's a little scared because nobody knows what the new normal is going to be. And that's probably one of the hardest things right now. Even if you're not in the healthcare industry, what you are doing at home matters. Shelter in place, stay safe, be smart. Those of you out there sending us food, sending us love, that really means a lot to us. Those of you out there making masks for one another, that's great. Just looking out for one another, it's great to see.